patients. So we decided to dig a little deeper and find out if any local patients were being affected or put at risk. Channel 3's Erin Kennedy went looking for answers. She's in the newsroom now with what she found. Hi, Erin.
Hi, Russ. We discovered that local hospitals are being affected by the government shutdown, but not in the way you might think. Here's how it all breaks down. The headlines are scary. Shutdown blocks kids with cancer from clinical trials. So Channel 3 decided to take a closer look. We sat down with the experts to find out if local patients were at risk.
We're not turning away clinical trial patients, thank goodness.
At some level, the title was probably a little bit more intense than the actual facts in terms of what we're able to do.
Those dramatic headlines focused on the National Institutes of Health in Maryland, which is federally funded and staffed by federal employees. 75% of those employees have been furloughed, forcing certain clinical trials at the NIH to be delayed. But locally, our doctors, those at the Cleveland Clinic, University Hospitals, Metro Health Medical, Case Western, they tell me they are still hard at work providing care to every patient and everyone currently enrolled in clinical trials. In a statement from Dr. John Letterio, sickness never takes a holiday and neither do we. Media should know that we and every other children's hospital and cancer center still have the capacity to provide care and enroll patients in trials.
When I see an article like that, it bothers me.
So even though local patients are not at risk, our doctors and our preeminent research institutions like Case Western are being affected by the government shutdown. Here's how. Certain grant proposals that rely on approval from the NIH are now not being reviewed, which means research on new groundbreaking drugs may be put on hold. But when it comes to your immediate needs as a patient,
the message is we still can do everything that we do today.
And the doctors I spoke with were concerned that if this shutdown drags out for weeks and weeks, there could be a significant backlog when it comes to getting their research grants approved. Also, a lot of these hospitals pay for those studies out of pocket, which means that their reimbursement from the government could also be delayed.